Nice morning for everyone. I am Dr. Rasha Salah Abdelhamid, Associate Consultant, Pediatric and Oculoplasty, Maghrabi Hospital, Dammam and Khobar branch. I will give small piece of information today about dry eye. Who of us don't complain of dry eye? Dry eye is a sophisticated problem now for everyone. Almost 90% of people have dry eye or suffer from dryness. Dry eye could be mild, could be moderate, could be severe. What are the causes of dry eye? Dry eye can be due to hyposecretion of the lacrimal gland or evaporative dryness or mixed dryness. What is hyposecretion of the lacrimal gland? The lacrimal gland is a gland here in the upper part of the eyelid. This gland's function is to secrete the watery layer of the tear film. In some people, these glands are not doing its function very well, especially by aging. The patients who have rheumatoid arthritis, systemic lupus erythematosus, some patients who have autoimmune diseases, these patients suffer from hyposecretions of these lacrimal gland. So the watery layer of the tear film become decrease in production. So these people will suffer from severe dry eye. Also, we have meibomian glands. These glands are oily glands around the eyelids at the margins. These glands, about 20 to 40 glands in each eyelid. This function of this gland is to secrete the oily layer of the tear film. Then, what's the function of the oily layer of the tear film? What is this gland if not doing its function? What we will have? If we don't have this oily layer, the tears will be evaporated fast, very fast from the eye. So we will have evaporative dryness. If even we use artificial tears, it will not remain in the eye for a long time. So when we are examining patient, we should determine if the patient have hyposecretory dryness or evaporative dryness or mixed dryness. Because according to the problem, we can solve it. For the patient who have hyposecretory dryness, we can increase it by using artificial tears. Sometimes the patient have some irritation, we can use anti-inflammatory drops. We use too much lubricant, increase the frequency and the viscosity of the lubricant until he gets satisfied. In some patients also we are using Restasis, this topical methotrexate eye drops to stimulate the lacrimal gland to improve its secretion and production. Also, we can use silicone punctal plug. What is this silicone punctal plug? These small plugs to occlude or close the opening of the lacrimal punctum, which is the site of drainage of the tears inside the eye. So, when we block the drainage, we are keeping the tears to remain in the eye for longer time, so the patient will feel satisfied and he will feel comfort and he is not feeling the irritation of the dry eye. Okay, this is for hyposecretory dryness. What about if the patient have evaporative dryness? We said in evaporative dryness, the problem is dysfunction of meibomian glands. So we need these glands to again return back its function. How we will make this point? How we will allow these glands to stimulate this gland again to work again and produce more oil? We have two things. Either we use anti-inflammatory medication, drops and ointment with hot compression, massaging, and use some shampoos and lid hygiene to improve or remove the bacteria between the eyelashes. It can work in some patients. And if not responding and the patient having chronic blepharitis, at this point we are doing the EI or intense pulse light treatment. This laser will allow this gland to regenerate and work again and secrete at regular and in normal way, so you can get your oily layer of your tear film and feel more comfort. Some of the patients have mixed dryness, hyposecretory and evaporative dryness. So sometimes we use lubricant plus intense pulse light treatment. Sometimes in other patients we can use punctal plug plus the intense pulse light treatment. Intense pulse light treatment are 3 sessions. Between the first and the second session, 2 weeks. Between the second and third session, 1 month. And we have very good result with it. See you in another video.